It's time for a business spotlight on this Friday morning featuring Morris Hospital and Healthcare Centers. And this morning I'm joined by endocrinologist Dr. Nuzhat Chalisa. Great to have you on this morning.
Thank you. My pleasure.
November's National Diabetes Awareness Month. We're going to focus in on the topic of diabetes. And why is it so important, doctor, that we talk about diabetes?
So diabetes is a serious illness. Incidence of diabetes is increasing worldwide, approaching epidemic proportions. There are 30.1 million people with diabetes, out of which 7.2 million are undiagnosed. And then you have another 84 million people with prediabetes.
All right. Well, who's at risk for developing diabetes?
So there are several risk factors for diabetes. Being overweight, sedentary lifestyle, family history of diabetes, having high blood pressure or cholesterol, certain ethnicities like being African American, Hispanics, Latino, Asian Americans have higher risk of diabetes. Also, women who have polycystic ovary disease or who have had gestational diabetes are also at an increased risk for developing diabetes.
I see. Well, are there any warning signs or symptoms?
So diabetes in early stages does not have any symptoms, and that is the reason why in a lot of cases it remains undiagnosed. But as it progresses, one may develop fatigue, increased thirst, increased frequency of urination, and then if it's not diagnosed in later stages, you may develop symptoms from complications like blurred vision and delayed wound healing. And any of these symptoms should prompt a visit to your primary care physician.
Okay, well, what's the best way to get checked for diabetes?
So the best thing is to get routine physical exam every year, which includes diabetes screening. Diabetes can be diagnosed by by measuring fasting glucose or a test called hemoglobin A1C. Morris Hospital and other hospitals run several programs throughout the year where free diabetes screening is offered.
All right. Well, now for people who already have been diagnosed with diabetes, why is the management so important?
So it's important to manage diabetes aggressively, as when blood glucose is high over a period of time, it can damage blood vessels and nerves throughout your body, leading to complications like heart attack, stroke, kidney failure, blindness, foot ulcers, and limb amputations. So by learning about diabetes and managing it, people can prevent diabetes and its complications.
I wanted to go back to something that you touched on. You mentioned the term prediabetes. What exactly does that mean?
So before developing diabetes, most people have prediabetes, and it is when your glucose is not normal, but it's not yet high enough for diagnosis of diabetes. Good news is prediabetes is reversible. It is indeed a window of opportunity for you. By making appropriate lifestyle changes during this stage, one can actually delay or prevent diabetes.
I was going to say, can it be prevented if you're in a prediabetes stage and you take proper care of yourself?
Yes. If you're in a prediabetes stage and you take several steps to change, make a lifestyle change, behavior change, or losing 10% of your body weight can make a huge difference.
Okay. Well, Dr. Chalisa, how do you help in your practice with diabetes?
So we see a lot of diabetic patients in our practice. We can help manage both diabetes and prediabetes. As appropriate management of diabetes will prevent complications. We offer an extensive diabetes program, including latest technologies and treatment options. Our team includes a nurse practitioner, a dietitian, and extremely trained nursing staff. We pay a lot of emphasis on diabetes education. We are celebrating Diabetes Awareness Day at our Channahon office. We will be offering diabetes screening, free hemoglobin A1C blood test, diabetes education sessions, and diabetes quizzes, and a lot of other fun activities. So please join us to celebrate the Diabetes Month.
And that is on Reed Street in Channahon,
That's Reed Street in Channahon. That's correct.
Then if folks have any questions, they can call 467-0555.
That is correct.
All right. Well, Dr. Chalisa, thanks for coming in this morning.
Thank you so much.
Appreciate you being here. Have a good weekend.
You too.